Good afternoon, everyone. I am Amir Ali, and today I will be presenting on the introduction of the systematic review. Here's an overview of what we will cover today. Introduction to the systematic review, types of reviews, difference between scoping review and systematic review, and steps of systematic reviews. So, what is systematic review? A systematic review is a review conducted according to clearly stated scientific research methods and is designed to minimize biases and errors inherent to traditional or narrative reviews. It follows a structured approach to synthesize all the available evidence. Characteristics of systematic review. Some characteristics of systematic reviews include clearly stated set of objectives with predefined eligibility criteria, an explicit reproducible methodology, a systematic search that attempts to identify all studies that would meet the eligibility criteria, assessing the validity of the findings, for example, assessing the risk of bias, systematic presentation and synthesis of the findings of the included studies. Further characteristics include a clear analysis of the results of eligible studies, statistical synthesis of the data known as the meta-analysis, if appropriate and possible, or the qualitative synthesis. Structured report of the review clearly stating the aims, describing methods and materials, and reporting the results. Now let's understand the hierarchy of study designs. It's crucial in the systematic reviews. This hierarchy determines the strength of evidence based on the study design. As you can see, the meta-analysis and systematic reviews are at the top, which provide the strongest evidence. If we go down to the bottom and at the last, we see the weakest evidence for the study designs include case report and case series. There are various types of literature reviews, including narrative review, scoping review, systematic review, and meta-analysis. A narrative review summarizes different primary studies from a holistic point of view, often incorporating the researcher's own experience and existing theories. It provides a broad overview but may subject to the biasness. Scoping review. A scoping review is a relatively new approach to evidence synthesis. It aims to provide an overview of the available research evidence without producing a summary answer to guide clinical decision making. The main purpose is to identify and map the available evidence. A meta-analysis. Meta-analysis is the statistical combination of results from two or more specific separate studies. It improves precision, answer questions that are not posed by individual studies, and settles the controversies arising from the conflicting claims. Systematic review. A systematic review is a type of review that uses repeatable methods to find, select, and synthesize all available evidence on a specific research question. It aims to minimize the errors and biasness. Difference between systematic review and scoping review. A systematic review aims to identify, appraise, and synthesize all the empirical evidence to answer a specific and a focused research question. while a scoping review follows a systematic approach to map evidence on a topic and identify main concepts, theories, sources, and knowledge gaps. Let's compare the two. Systematic review versus scoping review. Authors can be one or more. Systematic review has to be team-based, have multiple authors. Research question. In scoping review, it is focused or broad questions. The systematic review, the research question should be focused. Search strategy can be iterative and revisions are acceptable in scoping review. While in systematic review, search strategies has to be set, fixed, and developed. The results of the scoping review are larger result sets, while the systematic review have fewer results. Critical appraisal is optional in scoping review, while it is compulsory in systematic review. For protocol and reporting, we can use guidelines Prisma for the scoping review, while we have a different set of guidelines for the systematic review. Consider a scoping review when you have a broad research question, a multi-part research question that needs to be clarify or examine the key concepts, topics, or areas to conduct a landscape or an environmental scan or to identify a knowledge gaps. When to consider scoping review? It's a precursor to a systematic review. It's impractical to conduct risk of bias assessment and to incorporate multiple study designs. Steps of conducting a systematic review. Step 1 is to identify the research question. Step 2, to identify the relevant studies. Step 3 is the study selection. Step 4 include to extract and chart the data. Step 5 is to collate, summarize, and report the results. To formulate a research question, use frameworks like PICO, which is patient, intervention, comparator, and outcome, or PCC, which includes population, concepts, and context. To formulate a research question. This framework also helps to construct a clear and a meaningful title and inclusion criteria for the review. Here is an example of the PICO framework. P stands for the patient, I is for intervention or exposure, C is the comparison, and O is the outcome. As you can see here, for the patient, the example of research question is what are the characteristics of the patient or population? What is the condition or disease you are interested in? For the intervention or exposure, what do you want to do with this patient? About the intervention, example to treat, to diagnose, or to observe. C is for the comparison. What is the alternative to the intervention? Example, placebo therapy, different drugs, or a surgery. O is the outcome, means what are the relevant outcome? Example, morbidity and mortality rates or the complications. The example of PCC framework, population, concept, and context. In population, we can set the inclusion criteria like older adults age 65 or older. The exclusion criteria focus on the perspective than those of older adults themselves, other than themselves. The concepts include ICT for decision making related to and health and social care activities, technical devices such as sensors and alarms or robot technology as an exclusion criteria. The context include the home environment. The exclusion criteria include the focus on institutional care such as residential care facilities. Now, next step is to identify the relevant studies. Search databases like Cochrane, Database of Systematic Review, PubMed, and Prospero needs to be explored to identify the already published or in progress reviews on your topic. This is the example of the Cochrane library. This is the interface of the PubMed, and it is the interface of the Prospero, National Institute of Health and Cancer Research, an international prospective registry for the systematic reviews. The review process resources. The review process key sources include the Cochrane Handbook for the systematic review. For the scoping studies, they have a methodological framework at the International Journal of Social Research Methodology and the JBI manual for evidence synthesis. You can visit this by following the links here. To identify the relevant studies, like for example, from the PubMed, Scopus, Cochrane Library, or the clinical trials website. You need to create a search strategy. The search strategy should be comprehensive. It consider multiple databases, consider various types of evidences. The process should be iterative. Revisions are accepted for the scoping reviews, but it is not accepted for the systematic reviews. You need to document the search strategy. With the search strategy, you can identify the relevant studies with the comprehensive search strategies already used. See Galter information source page for the more databases. Step number 4, extracting the relevant information. To extract the relevant information, you need to charting or extracting the data. There is no standardized chart or a form. Data extraction form adopted from the Cochrane collaboration library. Form should be individualized. First, you need to pilot the form and then refine as needed. This is the example of the JBI template source for evidence detail, characteristics, and result extraction instrument for the scoping review. As you can see that it's the scoping review title, review objective, and the review question, the inclusion and exclusion criteria based on the PCC, population, concept, and context, and the types of evidence used, like the evidence source, details, and characteristics, which include the citation details, the country, context, and participants. The details result extracted from the source of evidence include the quality of live domain assessed, number of items in the tool, details of psychometric validation of the tool. These are, you can modify this according to your research. Risk of bias assessment. It describes the method for assessing the risk of bias in individual studies, whether at an outcome or study level. Use checklists like the Cochrane collaboration tools for assessing the risk of bias. Step 5 include collate, summarize, and report the result. Synthesize the data extracted during the charting process to present an overview of the literature. It includes the data that align with the review objective and the research question. You have to incorporate PCC or PICO elements. Use the grade approach to report confidence cumulative estimates. This is the example of collate, summarize, and reporting of the results. The characteristics of the included intervention studies except from the post-stroke fatigue, a scoping review. It is an example from the scoping review. You can see here it's the study name, the country of the study, the design used, number of participants, type of stroke, stroke after time, the interventions used after the stroke, duration of the intervention, the intervention delivered by, and the delivery mode. It is the list of all the studies which is included in the scoping review with the specific details. This is the Prisma flow diagram which depicts the flow of information through the different phases of a systematic review. It helps you to visualize the selection process and reason for the exclusion. You need to fill out this checklist when submitting the systematic reviews. It has the title, abstract, rationale, objective. You can get the detail of this from the Prisma 2020 checklist. It's available. Eligibility criteria, information sources, search strategy, selection process, data collection process, data items, s- study risk of bias assessment, effect of measures, synthesis methods, reporting bias assessment, certainty assessment. It has the 15 elements which has to be filled when submitting the scoping reviews. This is the Prisma flow diagram. It is also used in the scoping review as well as in the systematic reviews. It depicts the flow of information through different phases of a systematic review. First of all is the identification process. You need to screen the duplicates. Then you need to screen the articles based on the title and abstract and mention the excluded articles. You also need to mention the reason for the exclusion in a separate file. In screening process, after completing the duplicates removal, you need to again check for the full text article screening after screening the title and abstract. And at last, while this box will show the included studies after screening, after full text screening, according to the inclusion and exclusion criteria. To register your protocol, registering your protocol ensures transparency, claims your topic, and prevent competing the reviews. Platform for registration include the Northwestern Digital Hub, Prospero Open Science Framework, Systematic Reviews, BMJ Open, and JBI Evidence Synthesis. Prospero is the most famous and most commonly used website for registering the protocol. These are the references you can look at for the more information. Thank you.